think this is deliberate, right? There is a deliberate environment of confusion. And so it's patients are confused and healthcare providers are confused as well. We recently took care of a patient who had a fetal demise in a banned state, and taking care of a fetal demise should not fall under abortion bans, but she was so afraid to seek care in her banned state, and her providers were so afraid to take care of her that she delayed her care by weeks. She traveled to us. She had a procedure in Illinois, suffered a devastating hemorrhage, required transfer to a hospital, emergency surgery, an ICU stay, multiple blood transfusions. And at the end of this, the patient did well, but at the end of this, the ICU doctor, who I bet on a daily basis never thinks about abortion, looked at me and said, "This patient almost died because of abortion bans."
It's real.
It is real.
Yeah. Senator Smith, I'm going to turn it over to you, and I'm going to run up and vote, and I will be back in just a couple minutes.
Thank you.
Thank you. Thank you so much, Senator Murray, and thank you all to all of our panelists. I don't know if Senator Murray said this at the beginning, but there are so many people who want to hear what is happening in our country today around abortion. As you said, abortion is health care. This room is full. There's a next room next door that is also full. So I want you to know that your voices and the points that you're making are reaching a lot of people. I love that how clearly the boards behind you lay out what is happening, the backdoor Republican plan to ban abortion nationwide, because each one of you has told a story about, while they say that they want to leave this up to the states, all of the actions that are being taken by Republicans and their allies are really geared towards using fear and intimidation and blocking access to care in a way that actually does end up virtually banning that care. And whether it's Ms. Davis, your story of the great lengths that you had to go to, the stories, I mean, every single one of you have highlighted this. Renee, I'd like to turn to you. I know that you are friends with my friend who runs the Red River Women's Health Clinic in was Fargo, now Moorhead, Minnesota. And I remember quite clearly, roughly 20 years ago now, when I worked at Planned Parenthood, and this was post FACE Act, so FACE Act was in place. But I remember what it meant for patients and our care providers at Planned Parenthood to have to go through that gauntlet in order to go to work or to get access to care. And so I really appreciated you helping to tell us a little bit about that. And I'm wondering if you could just help us understand from your perspective in Michigan, what impact you think the president's pardoning of these folks that were convicted under the FACE Act and this increasing rhetoric around political violence. I see this so clearly, as many said, in my home state of Minnesota. What impact you see that having right now on the safety of your patients and the people that work at your clinic?
Well, first of all, I'm very sorry for the loss of your friend.
Thank you.
And the fact that you were also on a hit list. It feels like you're an abortion provider, something we've been living with for a long time, and I'm sorry to welcome you to that club. I think it's sending a clear signal that it's okay to break the law. Mm-hmm. It's okay to blockade our doors. It's okay to terrify patients, because that's their goal. Their goal is not to offer hope and help, as they say. Right. Their goal is to terrorize people, traumatize people, shame people. It's to scare our staff and scare our physicians and close our doors. Mm-hmm. That's their goal, to end abortion, period.
And you have told stories about the kind of incredible lengths that some of these folks would go to intimidate and some really disgusting things that happened in your clinics because of these folks. So just want to thank you for persevering. And I'm going to defer to my colleague. I think Senator Blunt-Roch. I'm not sure who's next. Senator Murray's staff will tell me, but I want to make sure I leave time for everybody else to I'm pulling up the list here. Make sure I have time for everybody else to ask questions, but I want to just highlight before I end that there's an active effort right now to, as you were saying, Dr. Brahm, to make it impossible for Planned Parenthood to get any kind of payment or reimbursement from our patients who are covered through Medicaid, and what a devastating impact that would have, including in states like my home state of Minnesota, where we still have robust protections for abortion care, but not if the clinics aren't there. Thank you. And now, Senator Baldwin, if you're ready, I will turn to you. And thank you so much for your incredible leadership on introducing the Women's Health Protection Act today.
Oh, good. Thank you. Yes, the Women's Health Protection Act is such a critical piece of legislation in order to restore Roe v. Wade and to inform the courts when states pass regulations or laws that are inconsistent with the rights articulated in Roe v. Wade, that they should be struck down. And we know, and one of my first questions has to do with all of the medically unnecessary rules and restrictions beyond just banning the procedure that states have enacted, and we have some in Wisconsin. But I wanted to just start by thanking Senator Murray for hosting our forum today to highlight the devastating impacts that were caused by the Dobbs decision to overturn Roe v. Wade 3 years ago today. Simply put, it's been devastating for families across the country, and we have to keep on drawing attention to the ongoing crisis that women in America are facing. For those of you who haven't followed each state closely, I'm from Wisconsin, and in Wisconsin, when Roe fell, our state reverted to a criminal abortion ban that was passed in 1849, before women had the right to vote, before the Civil War. And for 15 months in Wisconsin, there was no access at all. And then a trial court judge in one county determined that that statute was not intended to address the issue of abortion. It was a feticide statute. And so at that moment, one county in Wisconsin started providing services. And then two others joined. How did those two others decide to join? Because they had a district attorney and a sheriff in those communities who said, well, we agree with that decision in Dane County, and so we're not going to prosecute if anyone accuses a provider of violating the law. And so now we have 3 counties out of 72 in the state of Wisconsin where abortions are provided. And for the past 3 years, I've heard horrifying stories about women bleeding out or waiting for life-threatening infections to be able to access care. And while our Republican colleagues debate whether it should be the federal level or the state level that should decide abortion rights, I believe it should be women who decide. Full stop. And that's why today, alongside my colleagues, we reintroduced the Women's Health Protection Act. Now, let me be clear. My Democratic colleagues, all of them signed on to this bill. And they're standing together to say that we have the right to make healthcare decisions, and that includes the freedom to abortion care. So I wanted to ask a couple of questions, and I want to start with you, Dr. Baum, because the Dobbs decision forced women and their doctors to navigate a complicated and ever-changing sort of patchwork of laws at the state and sometimes local level that dictate Americans' rights based on their zip code. As I just mentioned, in Wisconsin, women can only access care in 3 counties, leaving women in the other 69 to figure out what the heck they can do to access care. But I spoke with a nurse in Wisconsin who, during the 15 months where there was no access, practiced, she went and helped out in Illinois because they were receiving a lot of patients from Wisconsin who couldn't get care in Wisconsin. And I just asked her what that was like, because in Wisconsin we have this whole set of non-medically necessary rules and restrictions, like a 24-hour waiting period, ultrasound, mandatory ultrasound, sometimes invasive. We have this sort of informed consent where you have to sit down with the doctor who's going to perform the abortion 24 hours in advance before you come 24 hours later. And then she was practicing in Illinois going, I never realized what it would be like to practice in a state where the whole focus was on the care and the health and the well-being of the woman. Tell me what it's like, since you practice in both limited or restricted states as well as states where it is legal.
Yeah, so I live and practice right on the border of Illinois and Missouri, and it is a stark difference. So, you know, I think the thing that I always remember every time I cross into Illinois is that my license is the same, my training is the same, my expertise is the same, and yet in St. Louis, there are things that I cannot perform, even though I'm trained and allowed to do those, and all I need to do is drive into Illinois and I can actually provide full service scope of practice to my patients. And it sounds like Missouri or Wisconsin took a page out of Missouri's books. I practiced, I did perform abortions up until 3 years ago today in Missouri, but we had an increasing number of what are called trap laws, which is what you're describing, targeted restrictions on abortion providers. Missouri had a 72-hour waiting period. We, again, required 2 in-person visits, invasive lab tests, invasive exams. And probably one of the hardest things for me is that I was required to give medically inaccurate information to patients. I was required to give a pamphlet that had incorrect, it had lies in it, and I was required to give that to patients. And all of these things made it harder and harder and harder to provide care, again, in the state in which I trained, in which I live, in which I raised my family. And so, again, we saw things shift to the state of Illinois, which over the same time enshrined access to abortion and sexual and reproductive health care. So every time I worked in Illinois, we saw patients traveling from all over the United States, but specifically from the South, and traveling 9 and 15 hours to have what is often a 3-minute procedure, or actually receive a pill, get back in their car, drive 9, 10, 15 hours home.
Yeah. I want to continue with you, Dr. Bohm. For many Americans, Planned Parenthood clinics are the only option they have for affordable care. And it is also often the only place women can go to get an abortion. Republicans are currently threatening to defund Planned Parenthood through this budget bill that we're debating this week in the Senate, which will only continue to take away health care from more and more Americans. How, in your read of the defunding provisions of this bill, will it make it harder for women to access reproductive care, as well as the other type of care that many types of cancer screenings, et cetera, that Planned Parenthood provides under Medicaid and private insurance?
Right. So Planned Parenthood clinics operate across the United States, but we have many, many facilities in underserved areas, rural communities, in which Planned Parenthood is the only provider of sexual and reproductive health care. And abortion is important and a core tenet of what we do, but we do so many other things. We provide comprehensive preventive care. We provide sterilizations. We provide, sexual and reproductive testing and cancer screenings, and people are going to have to make choices. So they're either going to have to wait to get their care and travel, as we're already seeing for abortion, and then traveling for cancer screenings, traveling for STI treatment, traveling for contraception, and all of these things have dire consequences, right? If STIs aren't treated, people suffer from infertility. If cancer screenings are delayed, people present with advanced cancers. And so people are going to be making really difficult decisions, again, that are not in their best health interests.
Thank you. And I have a final question, Ms. Timarashu. you and I have talked a lot about the Women's Health Protection Act and sort of the role it plays. And usually we talk about it as codifying Roe v. Wade. But states are still going to try to do everything they can to pass something that limits it here and limits it there, especially these unmedically necessary things that I was just talking about with Dr. Baum. How would passing the Women's Health Protection Act allow us to effectively challenge those medically unnecessary laws that get passed at the state level?
Well, one of the great things about the Women's Health Protection Act, thanks to you and Senator Blumenthal and all the great work advocates have done, is it addresses specifically trap laws. And it really creates protections against states doing whatever the heck they feel like in the name of women's health. And that's a really critical piece of the legislation. I'll also say, we're basically living in a segregated society, right? I have rights in Maryland where I live, but my family in Texas does not have those rights. And why we need to pass a federal bill to restore these rights and to address these inconsistencies in the way that states are interpreting those laws is critical. We have to have a nationwide protection. We cannot continue to function in a way where, depending on your zip code, you are considered a full human being or not. And that's what your legislation does.
Thank you.
Thank you. Senator Elizabeth Warren.
Thank you very much, Senator Murray, and thank you for organizing this forum on this day. And thank you, Senator Baldwin and Senator Smith, for helping co-sponsor this, and Senator Rochester and Senator Klobuchar for being here. Tough women get it done. And that's why we're here. So we all know that today marks 3 years since Donald Trump's Supreme Court overturned Roe versus Wade, and we have seen a new form of hell visited on women all across this country. Women who are forced to sit in hospital parking lots, hemorrhaging until they are close enough to death to be able to get the care that is medically necessary for them in the hospital emergency room. Women who are forced to carry doomed pregnancies for months. Women who are dying. And now, Republicans in Congress want to take a very serious problem and make it much worse. They are racing to pass Trump's big, beautiful bill, which will not only rip away health care coverage from 16 million Americans, but will serve as a backdoor ban on abortions in the states where abortion is legal. And Republicans haven't just stuck in one line into this bill to make that happen. They've done it on page after page. Number one, defunding Planned Parenthood. This could close nearly 1 in 3 Planned Parenthood health centers, with 90% of those centers that close currently located in states where abortion is legal. So, Ms. Davis, thank you for being here. Thank you for telling your story. When you experienced pregnancy complications, you were denied care because of Louisiana's abortion ban. I think that means that you can speak more directly than most people to the question of what happens to women all across this country if in every state it is increasingly difficult to get access to abortion because our local Planned Parenthoods have been closed.
Well, Planned Parenthood is a lifeline for so many people in my community and all around the world. I know I'm on Medicaid currently, and I still use Planned Parenthood. And not just for abortion. I've actually been a Planned Parenthood patient before I even had my abortion. I used Planned Parenthood for STD testing, for birth control, for cervical exams. So Planned Parenthood has been a lifeline for me and other people within my community. And if it is taken away, then there will not be any health care.
That's right. So the Republicans want to directly get rid of health care access for 16 million Americans, but they also want to slip in and see if they can close down a chunk of Planned Parenthood, which would block access for about another 2 million people who currently use Planned Parenthood, as you rightly say, some for abortion services, but for all kinds of other health care services. Dr. Baum, you are the Chief Medical Officer of Planned Parenthood Great Rivers in Missouri. So just explain to us, where will your patients go if more Planned Parenthood locations are closed?
Yeah, that's an excellent question. And the answer is there is nowhere for them to go. So we are part of the safety net. And while there are other providers that are part of the safety net as well, they are overwhelmed. And so there is nowhere in St. Louis or in the Ozarks or in Southern Illinois that can absorb the patients that we care for on a daily basis. So again, what I think will happen is there will be longer waiting times, diagnoses will be delayed, again, cancer diagnoses, infection diagnoses. People will delay care because there will be long travel times and long times to wait, and there will be dire health consequences.
Yeah. So that's part of the consequence with closing Planned Parenthood locations. But that's not all the Republicans are doing. They're also tinkering with cost-sharing reduction payments like the ACA marketplace in order to make it more expensive for insurers to offer plans that cover abortion. Now, we know that when insurers can cut corners to save a buck, they will cut corners to save a buck. And that means that plans either will stop covering abortion or that patients are going to have to pay more for plans that cover essential reproductive care. Now, Ms. Tiramisu, you are a national leader in advocacy for reproductive freedom, and I want to thank you for your work. We appreciate your leadership. Can you help everyone understand how losing access to affordable insurance will affect access to abortion?
Yes, and thank you for all of your leadership on this. And you are absolutely right. It has been a lot of work to get our nation's insurance providers to cover abortion care. We are finally at a point where many states are doing so, and the ACA plans in those states do it. So this is yet another example of how anti-abortion extremists are trying to go after abortion care in states where we have protections. So this is part of this backdoor abortion ban strategy by opponents. It will make it harder to get care. It will make it out of reach for many Americans.
Yeah. So many people here may remember that Donald Trump promised when he was running for office that he would leave the question of access to abortion up to the states.
Yeah.
It's pretty clear that he lied. And now the Republicans, less than 6 months in, are trying to find ways, a piece here, a piece there, to deny access to abortion care all across this country. And Trump's big, beautiful bill is aimed squarely at denying abortions in states where it is legal, by closing centers, by raising costs, and by wiping out coverage. But this fight is not over. The big, beautiful bill is not law. We still have the opportunity to fight back. And that means the time to tell your story is now, and the time to call your senators is now. And for everyone who has already done that, do it again. And once you've done that, do it again and again and again. And ask your friends to do it again. Ask your family to do it again. This is the time when we need to make democracy work by lifting our voices and make sure that everyone understands what's on the line with this bill that is right now in front of the United States Senate. We still have a chance to make a difference here. Thank you all for being here. Thank you. Thank you.
Turn to Senator Amy Klobuchar.
Well, thank you so much, Senator Murray. I want to call you chair because you're going to be chair again. Okay. And to all the senators that put this together, it's always great to follow Elizabeth. And when Elizabeth tells you she has a plan and you should follow it, then you should follow it. And it is true, all we need are 4 Republican senators to stand up on any of these issues, including the cuts to the healthcare centers and everything you've heard about today. So literally, we just need 4 people to be brave enough to stand up for the people of this country. So what do we know on this anniversary? We know that things are just as bad as they were a number of years ago in terms of some of these states. We've got women being turned away from emergency rooms, forced to travel hundreds of miles for health care, women sitting in hospital parking lots, waiting until their pregnancies are dangerous enough to qualify for care, doctors being threatened with prosecutions. I'll never forget the gut-wrenching testimony in the Judiciary Committee when Amanda came before us, Amanda Zarowski, and telling her story about how she nearly died from sepsis after being forced to carry her stillborn daughter Willow to term due to Texas's abortion ban. I've also been in our own state of Minnesota, and I know we have a number of friends from Minnesota. Thank you for being here. That we have seen actually because of our laws that were passed to protect abortion rights, and we're proud to have those laws on the books. But then we have people coming over as clinics have moved from places like North Dakota across the river to Minnesota. So we're taking in people, which we are more than happy to do. But it also has an impact, as you all know, on states that actually have legal abortion rights. So all of this is going on, and then you layer upon it what Elizabeth was just going through, and that is all of the added problems from this administration, closing down the health centers right in front of us right now, messing around with health care plans, messing around with mifepristone. And then, of course, where I'll start with my question is the judges. Since I serve on the Judiciary Committee, and this is for Ms. Tamaruju. Thank you for all your work, and thank you for almost have a name that scores more in Scrabble than mine. So as you probably saw, I pressed the Sixth Circuit nominee, Whitney Hermendorfer, another name, for her defense of Tennessee's near total ban, which does not provide any exceptions for rape or incest. The law also contained a narrow medical necessity exception that chilled doctors from providing care when they needed it. I asked her about one of the patients, Rebecca Milner, who had suffered preterm premature rupture of membranes. Her baby wasn't going to survive, and continuing the pregnancy put Rebecca's life at risk. Yet because of the law, her Tennessee doctor had to deny her the abortion care she needed. As a result, she traveled to Virginia. She developed sepsis that resulted from the delay in care. And that's just one story out of one state where, in fact, the nominee for the Sixth Circuit had made the case for this law. Could you talk about the importance of having judges who actually respect the law?
Thank you for that question. I talked earlier about Joshua Devine, who's another example of an extremist anti-abortion activist judge, and Maria Lanahan as well. You've got a lot of folks that we need you to stop from getting to the courts. We've got Judge Matthew Kaczmarek. I think he's the poster child for what Trump was able to do in his first term. Kaczmarek is the judge who moved some of the most extreme litigation around mifepristone that made it all the way to the Supreme Court, and he ended up getting dismissed on standing. Should have never made it out of his court. For decades, they've been trying to move a lawsuit like that. The courts are critical to reproductive freedom. We cannot do the work we need to do nationwide without the courts. In fact, in Wisconsin, I'll note it's been because of our ability to elect judges who are fair that we've been able to make the progress we were making. So at the federal level, it's so critical. Dobbs was the wake-up call, I think, for the American people about the capture of the court, the extremist tilt of the court. And I don't think we want to see many more cases go to the Supreme Court because we cannot count on them to protect us. So building that federal judiciary bench and protecting us at the appellate and federal levels lower than the Supreme Court is going to be really critical, including the circuit courts.
Thank you. And thank you in your testimony for mentioning Senator Smith and my friend Melissa Hortman, her husband Mark, that we miss. And I know you also brought it up. Thank you earlier. And as you know, Ms. Baum, there were, and Ms. Davis, there were Planned Parenthood was on his list,
Yes.
his target list that was public. Could you just talk about that relationship between political violence and trying to provide health care right now?
Well, Ms. Chelling talked about it quite a bit, and what she's been through with the FACE Act before and after. We're seeing a rise in political extremism. We're seeing a rise in authoritarianism when you have folks like President Trump pardoning folks who were prosecuted under the FACE Act, Jan 6th, insurrectionists. You are creating a culture of permission, a permission structure for these incredibly dangerous extremists to go after folks like your very dear friend Melissa Hortman, and to go after clinics like the IVF clinic in California that were bombed. And the fact that right now we have congressional Republicans trying to repeal the FACE Act in the wake of this political violence is unconscionable. And I don't think you can disconnect it from what we're seeing all over this country, peaceful, nonviolent protests for our democracy faced with crackdowns by this administration. It's an effort to chill us from protesting and from speaking out and from doing the right thing. It's an effort to chill the work of great clinicians and providers like the ones here today.
And my last question, thank you, Ms. Chelling. 7 of those convicted under that bill, then pardoned, had directly attacked your clinics and patients. Is that right?
Yes.
How do you, your colleagues, your patients feel after those pardons?
Well, the staff who quit after the blockade got mental health care treatment, came back to work, and when they were pardoned, they quit again. I just want to say, Michigan is probably one of the safest states in the country. We have a constitutional amendment that protects abortion and reproductive rights. We have, our legislature repealed half of the TRAP laws, and the Center for Reproductive Rights just represented me, and we won a victory to repeal the other half. We are probably the safest state in the country, but if the FACE Act is repealed, I'm thinking and talking to my colleagues that almost every clinic will close. We will not be able to withstand the kind of protests that we had in the 90s and the 80s. First of all, the people, the new workforce, are much more fragile. Mental health is a big issue in this country. And what these people do to us, the way they act, without breaking face, is something that's incredible every single day. And it's not protected under FACE, it's protected under free speech. But if we start getting blockades of 300 to 400 people, which if FACE is overturned, more and more people will be emboldened. Right now, the people who were prosecuted, and you mentioned the numbers, it's in the 20s, traveled from state to state and blockaded clinics. And they picked up a straggler here and there, but it was mostly the same people. However, if this law is repealed, on Saturdays, I have anywhere from 50 to 300 protesters at one of my clinic. A guy carrying an assault rifle with a fully loaded bullets on his back and a sidearm that's quite visible. That's legal. But I can tell you, if this law is overturned and those protesters start blockading our doors, we won't make it in the safest state in the country. And we'll start seeing clinics topple in the states where abortion is still legal and available.
Thank you for your work. Thank you. Yeah, thank you. Senator Lisa Blunt Rochester.
Thank you, Senator Murray, and thank you to my colleagues for holding this spotlight hearing. A special thank you to the witnesses for your bravery, your honesty, your vulnerability. The fact that there is actually an overflow room, that shows how important this is. And I think when we think about the overturning of Roe, I don't know about you, but it's, in your life you have like these days where you remember where you were when something happened. That's the Dobbs decision. I remember exactly where I was. I remember walking to the Supreme Court with my colleagues from the House. I remember walking back and playing Beyonce's You Won't Break My Soul. And I think for me, that's something that keeps me going. And so I want to thank you for that. And the fact that we went to bed the night before on the 23rd and we woke up with less rights than our mothers and our grandmothers. And so to me, when I thought about this moment and where we are and why this is so important to have this shadow hearing is because a lot of people really haven't been connecting the pieces of the puzzle here. We've been told that they don't want a national abortion ban. That's what Republicans said. But when you look at every single piece of this puzzle, it adds up to a national abortion ban. And so with this hearing and later on the floor, we want to show people. We want to make it clear that that's what's happening right before our very eyes. Quietly, but it's happening before our very eyes. And so thank you for participating. And I want to start off by also acknowledging, thank you for also sharing, Ms. Davis, your story as well, because we know that disproportionately, young women are affected, people in rural areas are affected, people who are poor are affected, and women who are Black and brown are disproportionately affected. Ms. Timaraju, Minnie, I've had a chance to spend time with you in Delaware, and thank you for coming there. Delaware is thought of as a place that's safe. And so I guess for all of the panelists, if there's anything that you can share, I want people to understand that nowhere are you safe in this country right now. And so if you could share some of the things that are happening right now, both currently and what is proposed, that will create that national abortion ban and make none of us feel safe. I'm going to start with you.
Sure, and I think you raise a really good point. Folks think, okay, I'm in a blue state like Delaware, I'm fine. And I've actually spent time with your state attorney general as well. I mean, we're seeing, we already had an access to health care crisis for women, particularly Black women in America. When I came to Delaware, we were talking about the Black maternal health crisis. So even in blue states where we have access to care, top-notch access to care, you still have health care disparities. So I think at the end of the day, what we're seeing is all these efforts, whether it's medication abortion, emergency medical care, attacks on emergency medicine, attacks on Planned Parenthood and the budget, attacks on Medicaid, it's all designed to get to care in your state, even though you think you've protected it.
Does anybody else want to share? I think when, Ms. Gilliam, when you were talking about the fact that what is perceived as a safe state is not safe, are there other efforts that are happening right now, Doctor, that you think needs to let people know, don't sleep on this issue right now?
Yeah, certainly. So again, I'm very fortunate to be able to provide abortion care in Illinois, which again, Illinois feels like a safe place, and patients travel. But I mean, I'm thinking about not too long ago, we showed up to the clinic at 7:30 in the morning and a patient was sitting out on the grass. She'd been sitting there all night long because she took a bus, I'm sure 9-10 hours that dropped her off in the wee hours of the morning. She had a hotel, but she had no ID. So she couldn't check into a hotel. So she sat outside all night long to wait for us to open to obtain an abortion. Nobody should have to sit outside to obtain basic health care. But this is happening, again, in Illinois, a safe, protected state.
Thank you. And Ms. Davis, my last question, I know you mentioned how you had to travel. Can you talk about some of the stories that you might have heard of hardship that women are facing? It's hard enough to make the decision, but then to have to jump through all of these hoops. Can you talk a little bit more about that?
Well, thank you so much for that question. That's actually a great question. I was fortunate enough to have that support system, to have family who can keep my children, who can, help me with help us with our house, go and check on a dog, and things like that. So I know a lot of women don't have that support system. So it makes it even more difficult to make 1,000-mile trip because of childcare, because of jobs. People cannot take off from their jobs. You know what I'm saying? So it's all types of barriers that many women are facing just to get basic health care.
And that is today. So I, again, want to pick up and end with Senator Warren's charge to everybody we have before us, whether you call it the big bad bill, whether you call it the big bad betrayal, whether you call it the big bad ugly bill. I don't care what you call it. It's bad. And it's bad for women. It's bad for families. It's bad for America. Tell your friends, tell your family, tell everybody. Spread the word. Thank you. I yield back.
Thank you.
Thank you.
Thank you.
Thank you, Senator.
We've been joined by Senator Schumer. Thank you for being here.
Yes, I just came to both thank you, Patty, thank our brave testifiers here and our organizers like Minnie. Some colleagues are speaking, and so I am just here to say thank you for being here and thank you for doing this.
Thank you. Thank you. Senator Cantwell.
Am I next?
Yeah.
Oh, okay. Well, thank you. I want to give my thanks to you, Senator Murray, for constantly leading the charge on this for so many years and being such a great advocate for Planned Parenthood, and to thank all the panelists for this moment to bring, just like it says up there, a spotlight. CNN just released a story about the Gut Marker Institute. They said 155,000 people traveled for an abortion in 2024. They went on to say that nearly all those who traveled for an abortion last year came from a dozen states that enacted total bans. Of that, including 28,000 from Texas. It breaks my heart to think that 28,000 people had to leave their state and come maybe to my state. And because I've talked to the providers, and you know what they say? It's heartbreaking. They say that people look for hotels. I said, well, wait, what does that have to do with it? Because oftentimes they have to bring their kids. They want the most affordable solution. Mm-hmm. They already had to buy a plane ticket and come here, and they are just trying to make ends meet, and we are forcing them to go get care in some other state miles and miles away. Why? Because of this arcane decision. So now we're here with this budget bill on the very day that we're...
Can you turn on your mic there?
Oh, that we are recognizing this, number that we now know, 155,000 people traveled and 28,000 from one state. And being a Western state, I'm pretty sure a lot of them did come to our state. So when you think about what they're doing in the budget and taking the Medicaid out, it is amazing because now we have two problems. We have people coming to our state and wanting this care, and now we have less Medicaid dollars to even provide the care. And so I don't understand how we're not already on this slippery slope where we literally have just undercut the entire system, and states that are trying to prop it up are now going to get the legs cut out from under them because of Planned Parenthood. But I had one of my constituents, Campbell Baker from Seattle, shared that she received an abortion at Planned Parenthood in Seattle after she was sexually assaulted. She said, quote, "I can confidently say that if Planned Parenthood hadn't been there for me, I would not be alive today. I know I would not have survived that emotional and physically with this pregnancy," end quote. So what are we doing? We're now affecting our states. We're affecting our states, our ability to deliver this care, and they are heartless in this. But Dr. Brahm, how can we better talk about the economics of this and the catastrophe that undercutting Planned Parenthood is going to mean for people like my constituent, who that's where she received care, while we're also serving the influx of a population from other parts of the country?
Right. So you're exactly right. And so what we're going to see is just a compounding of the problem that you're discussing. So people are, if we take away funding from Planned Parenthood and Planned Parenthood clinics close and abortion is no longer available in states where it is legal, then the remaining people that are able to provide abortion, the waits are going to be longer. And remember, abortion is a time-sensitive problem, right? An abortion that you get at 10 weeks may take 3 minutes and cost $500, and an abortion you get at 27 weeks takes 3 days and costs thousands of dollars and has, increased risks. So that's what we are seeing, and we see that all the time with all of our travelers. We see folks that probably would have presented months before, but they couldn't get to us because they didn't know where to go because of deliberate confusion. They didn't have the money. They weren't able to take off of work. They couldn't find anybody to take care of their kids. They didn't have the gas. Their car broke down, all of those things. And so that delays care, which again makes it riskier, more expensive, and that's what's going to happen.
Good answer.
Thank you. Thank you.
Thank you. Senator Cortez Masto.
Thank you. First of all, I along with my colleagues, want to thank you for being here and the courage to come forward. I thank you, Patty. Thank you to all my colleagues to help put this hearing together. I hate to call it shadow hearing because we shouldn't be in the shadows. This is what drives me crazy, right? This is not a shadow issue. This is an issue for women across the country, which are 50% of the population or more, and their families and their loved ones. All of the above, and that's why our voices now matter more than anything. I want to also put a finer point on what is happening with Planned Parenthood, because it's not just about abortion care. Planned Parenthood provides so many essential services, and not just for women, but some men come to Planned Parenthood. So can one of you touch on that? The other essential services, if we have to close down because we're gutting Medicaid, the Republicans want to gut Medicaid and cut down Planned Parenthood, who, by the way, are in some of our rural communities and probably the only health care we have in some of our rural communities. Who is losing out? What types of services, and who is missing out on those essential health care services? I don't care, Dr. Baum or Minnie or whomever might want to touch on that.
We take care of everyone at Planned Parenthood. I myself I'm an abortion provider. I am also a proud vasectomy provider. And as we know, vasectomies prevent abortions. It's true. So, but we want to take away the funding for that as well. We provide sterilizations, we provide cancer screenings, we provide, general primary care. And a lot of times we are the only provider that folks can get to. And so again, you're exactly right. This is coming at it from taking away abortion access, but also taking away basic health care. Sexual reproductive health care is basic health care. The ability to control your own body, to determine your family, to control your fertility is essential.
Yeah, thank you. Please.
The discussion around Planned Parenthood is huge, and there's no question they provide absolutely essential health care services. But the Trump administration has been so smart to make this the central theme, because more than half the abortions in the country are provided by independent abortion providers. So we will get the overflow for abortion patients if Planned Parenthood closes. And how will we handle them? We're getting patients who travel I get a ton of patients from Texas, and then they get here and they don't have a hotel room or the money for a hotel, or they got a hotel and they drove here, but they forgot about money for food and they brought their kids with them. And so we're raising funds for them to get food, to get a hotel room, and to be able to get back to their state. I mean, we already have a crisis, and when you add the face bill to that, these people, I've also had people sleeping on our grass. We find them covered with mosquito bites, so then we need to go buy some medicine for them and take care of them for, they slept on a bench in the bus station. They were lucky they weren't sexually assaulted all night. And the problem is so complex, but they're coming after us piece by piece by piece. And that's what we really need people to understand. Even if they don't defund Planned Parenthood and somehow this doesn't happen, the face bill closes all of us.
That's right.
Not just independent providers, but Planned Parenthoods as well.
Yeah.
And if they are allowed to shut down Planned Parenthood this way, they're going to come after all the providers then.
Yes.
Yeah. They've already started, for decades, they've been as you've really laid out, they've been harassing providers in order to disincentivize medical professionals from going into this work. So we already have a dearth of these professionals. We don't have enough capacity. We should be expanding abortion access. And I know so many states, and you've done such critical work to do that. We shouldn't be reducing the pool. And they're doing this because they actually know that abortions are going up in this country. So they're going to try to shut down abortion where it's legal by a lot of dirty tricks, including going after travel, which I know you've fought so hard. You've got this right to travel bill that's really, really critical right now. Anti-abortion activists are on the record trying to figure out how to shut down interstate travel, how to block folks from leaving states for care, because they know that we will get that care no matter what we have to do, and the advocates and providers in this room will fight like hell to get them that care.
That's right. You know, Nevada, I'm very proud of Nevada because in the 90s, there were some incredible, strong women in our state who actually used an initiative petition to codify Roe versus Wade in Nevada. And then we have just recently passed through an election, put it in our Constitution. That's how strongly we feel about it. And this is a swing state, right? Nevada is not a blue or red. It is a swing purple state, but people feel so strongly in Nevada about this freedom and the right of women. But you're absolutely right. It may be that Nevada, we have protected a woman's right to choose and her freedom over her health care. But what happens nationally and the fact that they are still coming after women's health care is having a chilling effect even in our state. For our doctors, when you are looking at across the country, even state legislation that looks to criminalize doctors for providing health care, let alone individuals traveling for that health care, has a chilling effect in my state. But here's the other thing I want to talk on, because, Ms. Chilling, I think you're absolutely right. I think Lisa, my colleague from Delaware, put this perfectly. There's different pieces of the puzzle that they are attacking. When you put it all together, it comes down to being a national abortion ban. One of them I want to talk about, what hasn't been talked about yet, is EMTALA. And so I want us to talk a little bit about this, because most people don't know about this law, which is a federal law that requires a hospital, emergency room, to provide care when a patient's life or health is at serious risk. They have to stabilize that patient before they can try to move that patient. It is an important law. It's been on the books for a number of years. And now what we see is an attack on EMTALA for individuals who need an abortion to stabilize them or for their health care. Into the previous administration, the president issued guidance, bless you, to the hospitals to say, here's how we interpret EMTALA, so you have to provide essential abortion care if somebody presents. Just recently, the Trump administration rescinded that guidance. And so I'm curious what you're seeing and hearing now from doctors, or even when there's emergency care, if they are taking that now, that rescission of that guidance, and is going to have a chilling effect on stabilizing women who come to emergency services in hospitals or wherever they may be to get that essential care. Are you seeing an impact yet on that? Because that is an essential piece of this puzzle as well.
So certainly. So I work with a large team of nurses that take care of all of our pre and post abortion patients. And we just had this discussion the other day because they answer all of the after hour phone calls. Somebody had an abortion, and like any procedure, there are going to be complications. And my nurses wanted to know, what do I tell people? What do I say? Do I say, oh, you're from a banned state. Is it okay to go to the emergency room? Do I have to tell you to come back, 10 hours to Illinois if you're bleeding? And I don't have good answers for them. We tell patients, you need to go get care, and I have to trust that providers in banned states will take care of my patients. But that's not always the case.
And the reason the Biden administration issued that guidance because we did see post-Dobbs people being turned away from emergency rooms, and they had to take those states to court.
Yeah, and I'm going to finish here because I know Dick is an essential piece to our conversation here. But let me just say, and it's not just the Trump administration, it is the people he's put into office. Yes. If you have a Department of Justice that says, for FACE Act violators, we're only going to prosecute extraordinary circumstances, that has no effect on somebody who wants to stop a clinic or be there or protest. If you have Robert F. Kennedy Jr., who oversees CMS and the enforcement of EMTALA, who doesn't understand the law or what it means, they're not going to enforce these provisions to protect a woman's safety when they present at emergency care. So it is the people he has surrounded himself with. And they are just as crucial to protecting and fighting for women's health care in this country than the man who sits in the Oval Office. And if we don't get word out, if we don't organize and talk about this and talk about it to our friends and our neighbors and our loved ones, man or woman, they are not going to understand how literally our rights and our freedoms when it comes to women's health care is under attack. And they are all systematically doing it to actually achieve a national abortion ban at the end of the day. I cannot thank you enough for being here.
Thank you. Senator Blumenthal.
Thanks to Senator Murray and all of our great advocates who have been here already, and to all of you champions, and to many in the room who have been advocates for a very long time. I've been involved in enforcing the FACE Act in Connecticut. People think Connecticut is a blue state with no threat to reproductive freedoms, but in fact, we have strong laws. We also have people who are ready, willing, and able to block access to the clinics that serve our people, and increasingly people from out of state, because we have also moved to protect in our state laws the doctors who serve women coming from out of state. And I know there is talk from time to time about repealing the FACE Act. The president pardoned 23 people who were convicted of violating the FACE Act, which in my view is absolutely abhorrent and unacceptable. But I'd like to know from you whether, particularly Ms. Chelian, what kind of protections are important, whether they need to be strengthened, whether you feel more secure because of the FACE Act rather than repealing it, whether they need to be strengthened.
Well, yes, the FACE Act needs to be strengthened. When we walk into the clinic in the morning and protesters are doing the kind of heinous things that they're doing, videotaping patients, trying to put their pictures on the internet, screaming and yelling and threatening them, intimidating and harassing them, particularly women of color and Muslim women. There's a large Muslim population in my area. And then they try to pick fights with the husbands or boyfriends or fathers of patients because they hope to get one of them arrested and be able to prosecute, press charges, and then subpoena clinic records to get the names of all the patients that are there that day to be so-called witnesses. We need FACE strengthened, not repealed. We won't last if it's repealed.
Any others have opinions on that issue?
Thanks, Senator. So House Republicans are trying to repeal the FACE Act. Shockingly, right after the IVF clinic bombing in California, they started, which is horrific. I started my career working at a Planned Parenthood in Houston, Texas, where we used to also have to cross throngs of protesters harassing our doctors. Our medical director wore a bulletproof vest to work. So we're all too familiar with the death of Dr. Tiller. I think what we're seeing now in context, though, it's the FACE Act repeals, but it's also the pardoning of the January 6th insurrectionists. It's the climate and culture of fostering extremism in this country, and an administration that is willing to pardon folks like that sends a very clear, chilling signal to the rest of the country that it's open season on our providers.
Many of the January 6th insurrectionists were recognized by clinics across the country because they are our protesters. And the clinics got in touch with DOJ and provided names of those people to help aid in arrests. I mean, those are the people who are at our clinics on a regular basis. they don't care about the law. You know that firsthand.
And I might just add that the FACE Act can be enforced by state authorities as well as federal. I did as Attorney General of our state. I think we'll be entering a period where we'll rely more on state attorneys general, because I'm not so sure this Department of Justice is going to be zealous.
And some states are passing their own state level FACE acts in anticipation of repeal of FACE.
Just a final comment. I introduced the Women's Health Protection Act around 15 years ago, I think, at a time when overruling Roe v. Wade seemed like a nightmare that could never happen. And here we are. The Women's Health Protection Act is alive and well with leadership from Senator Baldwin and Senator Murray. We're going to pursue it again. We're not giving up. It may seem like a bleak and dark time, but I want to assure all of you that the Women's Health Protection Act is essential to protecting women and families from the kinds of abuses that we see in many of our state legislatures. I don't know how many hundreds there are now in restrictive proposals in our state legislature that have been offered, but we need to keep faith on the Women's Health Protection Act, and I want to thank all of you again for your advocacy and your support. It really means so much to have you on our side. And this is an issue for men,
yes,
as well as women.
Yes.
This issue is about men because it's about health care. Health care is a human right. Women's health care is a human right. Men should care about it as much as women. And I'm glad we've been joined by a real advocate, my colleague, Senator Welch, who is also a steadfast champion. But again, my thanks to Chair Murray. I think you're chair right now.
Thank you.
Thank you very much.
Thank you very much. Senator Welsh.
Well, I echo what Senator Blumenthal just said.
Turn on your mic, please.
Thank you. You know, it's very sad to be here today, not just because it's the third anniversary, but what this Congress is about to do with these Medicaid cuts that are going to affect Planned Parenthood and the ability to provide care for no good reason, and these tax cuts, where the pain that's going to be inflicted is going to be bipartisan. It doesn't matter whether you live in a red state or a blue state, and I know we're all on the same page. But I went to our Planned Parenthood facility in Burlington, and it's so amazing to me that you've got these young people that are dedicated to providing health care and taking people as they come and as they are. And the folks who come in there are feeling insecure and vulnerable, and they're treated with this enormous respect and get the care they need. And what was inspiring to me was seeing it was mostly young women there who were providing the care, how much they really took great joy in being able to earn and have the trust of these folks who came in and were really vulnerable. And we're in the process, this Congress, of taking that away, closing those down. It's just astonishing. And I know all of you know it. So I just want to pay my deepest respects to you for your doing it. And Patty Murray, you're amazing. You have been such a champion on this in just such a fearless and direct way, and what a difference you have made for this Congress and for this country. So I just, and I've only been in the Senate 3 years, but I learned in my first year, you don't mess with Patty Murray. All right? She smiles, but she knows it's true. But let me just ask a couple of questions. I'm getting worried about the healthcare deserts. We have this legislation that's being passed. I don't know if you talked about that already. Did you? Yeah.
Go ahead.
Yeah. Well, 13 states have a total abortion ban. 28 have abortion bans based on viability. And a lot fewer abortion clinics, and doctors are totally understandably very afraid, not just doctors, to provide services. And, you know, I'd like to ask you, Ms. Tamara, and I want to make sure I pronounce your name right.
Timaraju.
Timaraju. Yeah, just to comment on this issue of healthcare deserts, because that even goes beyond reproductive care. It is all kinds of care that is really essential to the well-being of women.
Well, and it dovetails so well into this discussion around Medicaid and what's happening with this big, ugly bill. We already have significant healthcare deserts in places like your state, your very blue, progressive state, where folks cannot get access to care in rural areas. Lower income folks, particularly folks of color, are already on the margins of care, the most dependent on Title X programs, most dependent on places like Planned Parenthood that are the safety net provider in their community. In Georgia, for example, post-Dobbs, we've seen, and in many red states, but Georgia comes top of mind, they were already having a significant shortage of OBGYNs. They already had significant chunks of the state without any basic health care provider. And now post-Dobbs, you see a crisis of doctors who want to leave the state because they don't feel comfortable and safe doing care. And that doesn't necessarily make it any safer in your state. It means that doctors are more restricted and limited in where they can go and how they can practice.
Thanks. Ms. Chillian, just maybe you could comment about the Medicaid cuts. I'm sure you talked about that, but again, I just can't understand this, because the people that all of us represent, a Republican or a Democrat, are so profoundly affected by losing their health care. And our job fundamentally is to make sure that we make things better, not worse, for the people we represent. And there's nothing in this that does them any good and does so much harm, because it's unraveling these institutions that have been built over time. And it's not as though, even if we have a new election and a new president, you just flip the switch and everything goes back to the way it was. So,
well, we don't have Medicaid funding for abortions in Michigan, and I'm not with a Planned Parenthood, so those cuts wouldn't affect me. There is a lawsuit in Michigan right now challenging, based on our Constitution, our new constitutional amendment, whether or not Medicaid has to be covered for abortion rights, but that's in litigation. So I can't really answer, I think, fully the question that you're asking.
Yeah, so the Medicaid, this is important. There's the defund provision in the budget reconciliation, but Medicaid covers 40% of all births in this country. In some states, it's upwards of 50 and 60, like Arizona. So in my mind, Medicaid is a reproductive health care fight. It is a reproductive freedom fight. Even if it doesn't cover abortion, it covers birth, it covers prenatal, postpartum. And we have seen in states where, again, I'll say Arizona because I was just there with Senator Gallego talking about this. When they've expanded Medicaid to cover postpartum, we've seen a reduction in maternal deaths.
Right.
So that's what we're talking about when we talk about gutting Medicaid. Are we going to be a nation of forced birth, and then we're going to cut care and access to these families and let women die? That's what we're talking about.
Thank you. Thank you.
Thank you.
And leave children without adequate care.
That's right.
Thank you. I yield back.
Thank you. And we've been joined by Senator Van Hollen. I'm reminded of my good friend, Senator Barbara Mikulski, always said, if you want to get something done, ask a lot of women and a few good men. So we appreciate you all being here. Senator Van Hollen.
Thank you, Senator Murray. And let me underscore what Senator Welch said. Thank you for your leadership today and the entire time you've been here on this important issue, along with many others, but this is fundamental. And I want to thank you, Ms. Davis, for sharing your experience about having to travel over 1,000 miles to access the care that you needed. Nobody in America should have to endure that and that hardship. And to Minnie, it's great to see you, fellow Marylander. We work very closely together. And I'm going to really start with my question to you. It piggybacks on Senator Welch's, and I know other questions that have been asked here, but when it comes to the Republican health care cuts, right? They call this the big beautiful bill. I say it's beautiful if you're a billionaire, but for everybody else, it really sucks. And it is a betrayal of so many Americans. But one of the claims that they make is that they're going after sort of waste, fraud, and abuse, but it's really their cover for just creating more bureaucratic hurdles, right, for a party that claims that it wants to reduce red tape, what they've done is put a lot more bureaucratic hurdles in front of people who are eligible to receive Medicaid and the services. So if you could just talk a little bit about what the harmful impact of that will be. In Maryland, I think we are 40% of our births, are connected to Medicaid, but so many of our kids, but also, moms, dads, others. But specifically, what are the hurdles they're putting in front of people do, especially with respect to reproductive health care, but broadly?
So I think you might be talking about work requirements, which sounds like which sounds like a reasonable thing to ask for. You should be able to prove that you work, but we know that that's a non-starter. We know that most Americans who get Medicaid work. We know that the Medicaid is essential. I know Nancy. Nancy just talked about how she is a Medicaid recipient, and she is working nonstop. It is a program that allows folks to make ends meet, like so many social safety net programs. I also want to mention the impact beyond reproductive health care. When we got Medicaid in a state like Maryland, the disproportionate effect it's going to have on the provider ecosystem overall, forcing more folks who would go to a Planned Parenthood or their local clinic into ERs. And now we're undercutting EMTALA. So it's a perfect storm. It's a perfect nightmare. These requirements are just code for let's make it harder, but also sound reasonable.
Yeah. No, the reason I call them reporting requirements is because they like to call them
work requirements.
Really, they're work reporting requirements, and what they're designed to do is discourage people who have to work every day and have limited time to just drop off, because there's so much red tape involved in the reporting that, people are working paycheck to paycheck just don't have the time to do that. And
I feel like it's out of the playbook of what they've done to abortion and reproductive care.
Exactly. And I would say Senator Ulsterbrooks and I did a press call today on the impact in Maryland, and I'm glad you raised this point about it really will impact all insurance payers, right? Because when you cut Medicaid, as you know, it means there's more uncompensated care. And how is that picked up? By passing along those costs on the private insurance. And so I think it's really important when we point out that they're making these changes to provide tax cuts for billionaires, that yes, people who are getting cut from Medicaid are having to bear the burden, but so is everybody else, right, who has private insurance. And I think we need to hammer that home, so I'm glad you raised that point. Dr. Baum, thank you for what you do, and I understand you're the chief medical officer at Planned Parenthood Greater Rivers, and you help people in 2 states, right? One that allows abortion services and one that is much more restrictive or bans them. Could you talk a little bit about, you have a specific, very clear lens on the impact of restrictive laws in one state versus another, and how all of this that's happening here right now will impact people in both.
Right. So it is, like I said before, it is, a difference of a few miles in which whether or not I can offer the entire scope of normal reproductive health care to my patients. So in Missouri, I am limited to what I can do. Even though, again, I'm trained, I know how to provide the procedures, I am not allowed to provide the procedures that I am trained to do and that I know my patients want and need. And so, again, in Illinois, we are protected. We can offer, again, the entire scope of practice to my patients. And so I think, we talk, right, I live in Missouri, I can drive to Illinois, that's pretty quick. But I think there is a real emotional and intellectual burden to people to have to leave where they live for healthcare. I think that is a real thing. And whether they are traveling, and I see patients from Texas, Louisiana, Florida, every time I work, whether they are coming from, far-flung parts of the South, or whether they are coming from St. Louis, they have to leave the place that they raise their family, that they pay their taxes, that they send their children to school. That state says you can't make your own decisions about yourself and your family to travel to a state that does respect those things. And I think there was a real, again, beyond just the economic burdens of travel and gas and childcare and all those things, there is a real emotional, intellectual burden too that your state does not care about your bodily autonomy.
Thank you for sort of underscoring that point, which is why we've got to get back to making sure that everybody in all 50 states enjoys reproductive rights. Thank you all very much. Thank you.
Thank you.
Thank you.
Senator Hirono, are you ready? You just walked in.
I just dashed over from my education, and Senator Van Hollen was there. So thank you very much for being such a leader, Patty, on choice issues. And yes, this is the anniversary. Time flies, and a lot more terrible things have happened that makes it so much harder for women to get the reproductive care that they need. So I appreciate Senator Murray's leadership, as I said, and all of you who are on the panel. I did have a question about a recent decision by the Health and Human Services and Dr. Oz. They have rescinded the provisions that relate to how EMTALA would be implemented. So the letter that went out to notify people of that rescission of the guidance said that the law still exists, but how they're going to implement it without the guidance, I'm not sure. So it's just going to add to the confusion, chaos, don't you think? So anyone who wants to weigh in about what we can do, we are putting out I am leading a letter. Not that, frankly, it's going to make a difference, sadly, with Secretary Kennedy or with Oz, but to ask them to reconsider the rescission of the guidance. What do you think is going to happen in hospitals when people show up with emergency care needs, including abortion, and the guidance have been rescinded?
I mean, I will tell you, patients are going to die. That is what is going to happen. People will delay care because they are afraid, and healthcare providers will delay care because they are afraid of being prosecuted or being turned in by a colleague for participating in abortion care. We have to talk to our patients all of the time who travel from banned states and then go home about what to do if they have a complication. Can they go to a hospital and say, I had an abortion in Illinois? I mean, we don't tell patients to lie, but you're very tempted to, because otherwise they're afraid to go, and what will happen is they will stay at home, they will get critically ill, and they will die.
Did you want to add something?
Yeah, prior to this decision, we've had patients go to emergency rooms because they lived too far, they couldn't come back to the clinic, or they were from another state and were refused care. I've called the hospital administrators and said we were going to turn them over to the federal government for an EMTALA violation, and they suddenly took good care of, well, I can't say good, but they took care of the patients. And now we can't use that anymore.
And I'll just add, EMTALA is still the law. What the Biden administration had to do was advise and explain, you need to enforce this law in states with abortion bans.
Yes.
It is still the law. They had to clarify that. They had to clarify that because of all these horror stories we have of women almost dying of sepsis in parking lots because ERs weren't taking them. So it was necessary. It is still the law, and it's important to keep reiterating that, and it applies, but it just makes it so much harder.
The thing is that the Biden regime, the Trump regime has said that the guidance did not comport with and I'm paraphrasing a little bit, did not comport with the Trump regime's attitude toward EMTALA. And so really there's a contradiction, right? Because they say that EMTALA still is the law, but they provide no guidance on how to implement it. And I think sadly and tragically, women are going to die. So since the Dobbs decision, there are some states that immediately enacted anti-abortion laws, and there are over 20 states. And now we're being told that Title X funds will be withheld, and that those are funds that are used to provide all kinds of reproductive care, services, guidance, all of that. So that's being held back. And so that there's also a provision in the bill, the bill that we're going to be dealing with that basically defunds Planned Parenthood and does not provide Planned Parenthood with Medicaid reimbursements, which means that something like 200 Planned Parenthood providers across the country, many of them, by the way, are in states that allow abortions, but they're just not going to be able to get the funds to provide the kind of reproductive care. So it's a continual assault on our right to make decisions about our bodies. And the idea that somehow, unless you're in this category of people who need emergency care, et cetera, that it doesn't impact you. I was just asked about that. Like there are people in this country who think that as long as it doesn't impact them, it's not a concern of theirs. How do we articulate that this is an issue that it should concern entire communities and families?
So I'll just mention, Senator, that this room is filled with storytellers from across the country, including Nancy, who are part of a larger project to amplify and tell stories about how abortion bans have affected them. And that is the number one tested way to persuade audiences. Most Americans are with us on the fundamental right, but they are not necessarily convinced or aware of the devastation, the ongoing devastation of the Dobbs decision. And the best way to get more Americans of different backgrounds to understand and feel the alarm we feel is for them to see and hear the voices of folks who've been traumatized by these bans, and to understand that they could be one of them too.
Nancy, did you ever think you'd be sitting here talking about this?
No, ma'am, never, never. If someone would have told me a few years back that I would be doing this, I probably would have bet my life on it that they were lying. Yeah. I'm sorry. Yeah, so if someone would have told me this a few years ago that I would be doing what I'm doing now, I probably would have bet my life on it. That's how we know it can happen, right? But we don't really think that it would happen to us until it happens.
Oh, that's why I'm really glad you're here. May I just ask one more thing? After the Dobbs decision, there was a real organizing effort and people becoming advocates, and I don't know that kind of fervor in support of a woman's right to choose is still there. I'm concerned that in spite of the fact that more and more women are being impacted by these anti-choice bills, that there is less of a concern or empathy toward fighting back. And, you know, we now have the situation where the new guy who is on the FDA, I didn't vote for the guy, but he's talking about maybe we need to rethink the FDA approval for mifepristone, which would have a devastating impact all across the country. So are we doing those things that continue to galvanize our communities in support of what we're choice?
More Americans than ever before are with us, including the majority of Trump supporters. Right now, in addition to these storytellers who are here on the Hill today, we have Reproductive Freedom for All. We have 100 of our members from 22 states hitting the Hill, the House and the Senate to fight these Planned Parenthood defund efforts and the Medicaid fights. We've seen our membership continue to grow. We've seen our engagement continue to grow. Our activists are fired up. The challenge is, in this chaotic environment with this Trump administration, it is very challenging to break through and explain to the average American that all these little pieces that I think Senator Blunt Rochester called a puzzle, to pull it all together and explain this is a national abortion ban. That is why these storytellers, and making sure we have content creators up here as well who are capturing these stories, capturing these conversations, and we've got to be meeting audiences where they are. So yes, in the streets, we were part of the No Kings protest, we were part of all the big, hands-off rallies, but we also have to get into their social media feeds. We have to meet them in their communities, and we have to be investing in those storytellers too.
Thank you.
Thank you very much. Well, I want to thank all of our panelists for participating in this. We've gone way over time, but I'm okay with that because we need everybody to understand how critical this is. This is an important conversation, but to all of you, it is far from over. It is far from over. We are 3 years in, and it's really clear from listening today, from all we know, that the heartbreak and damage that Republicans are causing on abortion is only growing. But as Minnie just said, so is the opposition. Yeah. And we are not going to be quiet. We're not going to let women's stories go untold. We're not going to let your voices go unheard. We're going to keep a bright spotlight on the harm that Republicans are causing with their anti-abortion extremism. And we will be fighting with all we have, right, Maisie? Here and everywhere. To undo these damaging policies and work to restore a national right to abortion. So I want to thank all of you for being here and sharing your stories and your information, and ask all of you to join us in the fight. Thank you.
Thank you.